Okay, our next presenter is Dr. Matthew Martin, who's presenting on using Geographic Information System data to measure medications for opioid use treatment access for pregnant and parenting women.
Hello, everyone. Welcome to Treatment Access Disparities for Pregnant and Parenting Women with Opioid Use Disorder in Arizona. This is my bio. My name is Matt Martin. I'm a clinical associate professor of behavioral health in the College of Health Solutions, and happy to be here. And then here is my agenda. I do have some slides covering the treatment for opioid use and misuse. Also, I'm going to talk about the project origin and procedure, preliminary project results, and then a new proposal that we are pursuing. This is my project team. Very grateful for their help and support. Could not have done this without them. I'd like to also acknowledge the incredible contributions of these organizations and personnel. Very, very grateful for what they've done. And then also very grateful to our sponsors who helped to make this project possible. Okay, I do have some slides on the treatment for opioid use and misuse. This includes information about prevalence and severity in Arizona, as well as the diagnostic criteria for opioid use disorder and some information on medications. I'm going to skip that, but you will have access to the slide deck if you want to review it. So I'm going to jump straight into project origin and procedure. Okay, so this project started after a community partner asked for a map of the locations of prescribers of MOUD. That stands for Medications for Opioid Use Disorder. That's the gold standard for treating opioid use disorder. That includes things like methadone, buprenorphine. And so we went and we found some funding through a seed grant, foundation grants, and then we stumbled upon a state contract. We used public data sets and protected data sets. And we initially tried to find the locations using phone interviews, but a lot of the clinics, the majority of the clinics just would not respond or just did not have time to participate. So that methodology failed. And so then we turned to claims data, which was successful. We used a longitudinal study design, tracking changes in opioid overdose risk over time, and we used multiple data sources. Here is a conceptual model for the project. We were trying to identify the location of these prescribers and then measuring the distance in miles between the prescriber and a community based on census tract data. We also wanted to quantify the risk level of these communities based on a composite score, which I'll talk more about. So the composite risk score includes a combination of multiple risk factors, and the purpose of it is to try to predict future drug overdoses. That is what the conceptual idea is with these composite risk scores. So we calculated those, and then we assigned each community in Arizona with a risk score. We collected our data sets as we set off on our project. We created the index score. We assigned that risk score to each census tract. We mapped it using ArcGIS. These are the data sets that we used. You can see things like drug overdoses and prescriptions for opioids, and then also proximity to providers. We also use census data, poverty, insurance access, housing, transportation, and then crime rate data. And then we used BRFIS data as well. These are survey data. These data are available at a national level and also, I think, at a state level. But if you want to go beyond the state level to the community level, you do need to go through a state authority, and that's what we had to do as well. So we found we got access to this survey data on physical health, mental health, and poor health. We measured the distribution of the risk scores across the entire state. We calculated the proximity from high-risk communities to MOUD prescribers. And then we created an interactive GIS platform to visualize the distribution. And our project is not done. We're hoping to do the density mapping, which is basically where we want to identify where are the hot spots, where are the communities that really have the highest need. And then our optimization model will help us to know where can we place new resources, whether it's like a mobile health clinic or a new actual treatment center, or where do we need to train existing providers in managing opioid use disorder. Okay, so here's our preliminary results. Let me start with the lessons learned. First, we learned that it was very important to partner with experts on GIS and big data, also to be patient in requesting protected data sets, to avoid building new data sets like the phone interviews that we did. That was ambitious and just not feasible. So we had to abandon that. And then to seek funding. Funding was really important to support our personnel and to purchase access to the data sets. You can view the ArcGIS maps that we've created. We're continuing to refine them. Data validation is an important step. I imagine that there are some parts of the map, there are some markers where the data might be outdated or it might be incorrect somehow. And so we do need to go through and do more data validation. But looking at the map, it makes intuitive sense. Just doing like a visual analysis, you can see that a lot of the clustering is happening in the urban areas. Overall, we found that community-level overdose risk can be analyzed using GIS data and mapping. Resources for preventing and treating opioid use disorder are limited. Policymakers and practitioners should target resources toward communities that experience high risk for future opioid overdoses. And that's important, especially as the state attorney general is making decisions about how to use the opioid settlement funds. Okay, so here you can see some screenshots from the ArcGIS platform. This shows all prescriber locations across the state. These are individuals, these are medical providers who can prescribe methadone, buprenorphine. So on the left-hand side, you can see the entire state, and it makes sense. You can see that there's some clustering in the urban areas, including outside of Phoenix and Tucson metro areas. And then on the right side, you can see the Phoenix metro area, and you can see the locations as well. So these could include physicians, nurse practitioners, as well as PAs. Okay, and then these are the individuals that not only have a documented history of prescribing MOUD, but they also have documented history of expertise in PPW, in providing women's health care. And this is based on claims data. So here on the left side, you can see that there are some areas that there are gaps, there are disparities. So I'm looking on the left-hand side, Lake Havasu City, and then closer to the northwestern part of Arizona, like Kingman area. We did not find any providers. Down in the southwestern part near Yuma, we did not find any providers. And then north of the I-40, there really are not a lot of providers as well in northern Arizona. So Flagstaff up into Grand Canyon, Page, Arizona. So these are areas where PPW, pregnant parenting women who have opioid use disorder, if they want to find a provider who has expertise in women's health care as well, has a history of prescribing buprenorphine and methadone, it seems like it's going to be difficult for them to find that treatment access. And then in the urban areas, it seems like there's lots of access, lots of availability. Okay, and then this one shows the risk levels. On the left-hand side, you can see the entire state in 2016, and then on the right-hand side, you can see the risk in 2020. And you can see that there was a change, or at least there is a difference between those 2 years. The dark red indicates high risk for future overdose, and then the dark blue indicates low risk. So that's at the state level, and it makes sense what we're seeing here. We're seeing higher risk in those rural areas where there are fewer providers. Now, this takes a look at the same data for the same years, but in the Phoenix metro area. And we can see, for the most part, especially in the suburban areas, there seems to be lower risk. But once you get to certain communities or you get outside of the suburban areas, then the risk tends to increase. And it seems like the risk overall lowered by 2020. Now, we would be interested to see how that changed with the pandemic. And then here you can see it for Tucson. Okay, so I'd already talked about the density mapping. We're going to move forward and try to complete that analysis as well as the optimization model. We want to find out where are the best locations for increasing treatment access. And as far as a new proposal, we partnered with Access on going after funding for a state pilot program focused on northern Arizona. We partnered with some medical providers up in that area, the Guidance Center, North Country Healthcare, Northern Arizona Healthcare, Southwest Behavioral and Health Services. And we actually just submitted funding for 3 years that would help us to start to increase the integration of services, both medical and social. So hopefully that funding will come through and we can start that state pilot by this fall, actually, September. Okay, so, and these are the references. Okay, thank you. If you have any questions, please feel free to reach out to me. Thank you very much.